Now, for years, medical emergencies in Kenya have been a race against time and cost. Many people have lost their lives while waiting for an ambulance, while others have been denied emergency treatment because they could not afford to pay a deposit. Now, the government says this is set to change with the introduction of a single national emergency number, 922. This comes in the wake of an ongoing nurses and clinical workers strike across the country.
Kenyans will now access emergency medical services through a single national emergency number, following the launch of the National Ambulance Dispatch Center by President William Ruto. The center will coordinate ambulance services across all 47 counties.
From today, Kenya has one national medical emergency number, 922.
The first National Ambulance Dispatch Center signifies coordinated emergency response between the national and county governments, hospitals, and emergency response providers.
When you call 922, the call will be free on every network, and it will be accessible whether you have airtime on your phone or not. Ambulance evacuation and the first 24 hours of emergency treatment will be paid for through the emergency, chronic, and critical illness funds at the approved tariffs. This protection applies whether the patient is registered with SHA or not, and whether or not they have paid for SHA.
Concerns are emerging on the seamless nature of these services following the recent strike by nurses and various health cadres across public health facilities, which have affected the dispensation of health services.
A family may be 3 or 4 hours from a hospital on a good day, but not on a rainy day where the roads are impassable. And I come to that because when this ministry speaks about ambulances, I am not reading from a policy paper. I am describing a very arithmetic of my own people and the millions of Kenyans who live where distance itself sometimes becomes a disease.
Nairobi alone has coordinated more than 4,500 emergency cases over the past 4 months and plans to add 20 more fully equipped ambulances.
We've been able to set in place governance mechanisms. As you've seen, ambulances are checked. We ensure that these ambulances are safe and they'll be able to do what they need to do to rescue Kenyans. The second one, Your Excellency, is financing. Your Excellency, your government has provided adequate budget to be able to actually conduct and pay for the dispatches, as well as pay for the first 24 hours of care.
If the system delivers on its promise, the number 922 could become more than just a telephone number. It could become a lifeline for thousands of Kenyans in need of timely emergency. The launch of the National Ambulance Dispatch Center will be the first line of emergency response in Kenya. This initiative aims to save lives by enhancing timely medical care and emergency response within the country. Helen Aura, NTV.